progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
During the past several years, much has been written about a preparation called platelet-rich plasma and its potential effectiveness in the treatment of injuries. My guest today is Dr. Justin Sherfey. He's an orthopedic surgeon and a member of the medical staff at Palmdale Regional Medical Center. Dr. Sherfey, tell us a little bit about platelet-rich plasma, or PRP. What is it, and what is the evolution of it?
Sure. Well, it is a process where we actually take the patient's own blood. We draw out some blood just like you would get any blood draw when you go to the lab or have some testing done. And we then take that blood and we process it, where we separate it into its different factors. And out of that separation, we take out some of the growth factors that are normally found in your blood, as well as the actual platelets that are found in your blood. And we take that part of that sample, and then that's injected into different areas of the body, whether that's into a joint or into a tendon or into an area of injury. And the whole process, the goal of it is to take some of these natural healing factors that you have in your body and concentrate them into kind of a very high level. And then by injecting that into an area we want it to have some action, it hopefully can stimulate healing and encourage your body's own natural healing process, but in a much more kind of intense way.
So which conditions would benefit most from platelet-rich plasma?
Well, the process was first studied in tendon problems, particularly into Achilles tendon, as well as into the lateral elbow, what we call tennis elbow or tendonitis. That's where this was first kind of trialed and studied and had the most success. And up to today, it still probably does the best in these areas, but it's being expanded into multiple other things, such as joints, including hips, knees, elbows, ankles, where we hope to, have some effect on the arthritic process as well.
So then tell us about the benefits for the patient and a little bit about the science behind it. What you tell your patients when they say, okay, so, how does this even work?
Sure. Well, the first thing we tell the patient is it's your own natural, body's product. We're not adding the artificial medicine. We're not adding something synthetic. We're basically taking what you already have in your body, your blood, and we're just concentrating it. Normally, when you have an injury, your body naturally starts a healing response to try to deal with that. Well, we're taking those factors that are found in your blood and we're super concentrating them so that instead of a normal response to it, we're giving you, a 10 to 100 times the response for your body to deal with that. So the science is really just taking your normal factors, which are called growth factors, and these hormones that are in your body and in your blood, as well as taking the platelets, which have some anti-inflammatory and healing properties. And when we take that and put it in another area of the body at a super concentrated level, it just kind of starts that normal cascade of healing, really triggers it to occur. So that's the whole process, is we're trying to get some healing. We're trying to have your body heal itself naturally. We're just encouraging it.
Tell us about the procedure itself. What's it like?
Well, the procedure takes anywhere from about 15 to 25 minutes. Basically, most of the time, this is just done in the office. It can be done in other settings as well, but you come in, you have your blood drawn, just again, like I said, like any time you would get a lab test. That blood is then taken to what's called a centrifuge, where it separates it by spinning it rapidly into its different factors. That takes about 10 to 15 minutes. After that, we draw out the parts of the blood that we want, which I said was the growth factors and platelets, and then those are injected, just like you would receive an injection anytime in a normal office visit if you've got like a cortisone shot or something like that in the past. There's nothing really fancy about the procedure. It's just that we're using, parts of your own body in regard to the blood products.
Is this an image-guided injection, or does it not really need to be?
It depends on the area. In some areas of tendons, there are some things that are very superficial, or a large joint, you may not need to use image guidance. In fact, I would say probably 70% of the injections I do of PRP are just office-based non-image guidance. Now, you can use image. You can use ultrasound in the office to help ensure you're getting it in the exact area. When I do it into a hip joint or a shoulder joint, something I want to ensure I'm actually in the joint into the deeper structure, I usually do this as a small outpatient procedure in a surgical center or hospital, and then we do it under X-ray guidance in that case. So it can be done either way.
And how often does it need to be done?
So the whole process, once it's done, it takes about 6 weeks to really see if your body's going to respond. Your body has some initial anti-inflammatory effect, and so you get a little relief early. But then this is kind of, I tell my patients, it's kind of like planting grass seed. You kind of put it in there, and you've got to let the process occur, and that body healing response takes about 6 weeks. It can be done, as frequently as needed. I mean, there's no side effect. There's no downside. It's your own natural body healing and own factors. However, most of the time, a person only needs a single injection. In some more chronic issues, depending on the response, they may need 2 or 3 injections.
Can it help somebody avoid surgery, Dr. Sherfey?
Oh, absolutely. That's the goal. And in fact, a lot of times in this last 5 years of my practice, as this has become more mainstream, that's kind of what I talk to the patients about. I say, hey, I have an alternative. This gives your body some healing potential, and this may help either delay or avoid a surgery altogether, depending on what we're treating. Now, it's not going to reverse, very advanced arthritic. It's not going to make you, 18 years old again, but it can definitely help some of these problems, heal themselves. And I have seen it myself, multiple patients with issues of rotator cuff partial tears or some small meniscal tears or some chronic tendonitis. They're healed and they avoid surgery after, as simple as 1, maybe up to 2 of these treatments.
Wow, that's really cool. And what a neat, advanced kind of procedure that isn't invasive for the patient. So wrap it up for us. Give us your takeaway. Tell patients what you want them to know about this type of stem cell treatment, platelet-rich plasma, that can help them maybe avoid surgery and heal their injuries.
Well, sure. Well, it's a couple things I always want the patients to know, and I think this is the best way to wrap it up. Number one, this isn't a magic potion. So, you hear a lot about this. This is becoming a very popular thing. You hear professional athletes doing it. It's on TV. You hear it in the newspaper articles, online. You can find out all about it. But you have to remember, there's appropriate things that this can be used for, and this isn't magic. It's not going to be used for everything. I see people promoting it for things that it's not meant to do. But it is a very good option, and it is something that can really work. The science is very young on it, and we don't really have a lot of research out there. It's just starting. And so, it's new, and we're still learning about it. And I'm sure over the next 5 years, we're going to have this process down to even a more exact science. We're going to know what the dose should be. We're going to know which places it's really going to work and what it's probably not going to work for. So I would tell the patients, just, know it's out there, know it's an option, talk to your doctor about it, and it may be a very good option for you to avoid some surgery.
Thank you so much for explaining that to us, Dr. Sherfey. What a fascinating topic we discussed today. Thank you again for joining us. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.